I'm Dr. Sandra Petersen, and I am the Senior Vice President of Health and Wellness for Pegasus Senior Living. My purview includes all of clinical for Pegasus Senior Living and making sure that our residents receive the quality of care that they deserve. I think one of the reasons that assisted living has been so successful over the years is really looking closely at individuals' functional level through what we call a functional assessment, and that includes cognition, so that we see what we add back to their care to help them be independent as they can be and successful in having a good quality of life. Dementia is, I guess, to look at it holistically, a disorder, a cognitive disorder, a neurocognitive decline that results in individuals being unable to perceive the environment correctly and respond to it correctly. That's really kind of a nutshell definition, but all dementias, regardless of the type, have that in common. Pegasus has implemented some great strategies to enhance quality of life, and I think one of the ones that is important is our connections programming that addresses those with neurocognitive disorders like dementia. And what we've done is to incorporate neuroplasticity into our programming. So we're, in essence, building extension cords around damaged areas of the brain so people can access those old files. We help them connect emotionally. We reconnect synapses across midline of the brain through our move sequences, and then help them reminisce and learn. So our connect, move, learn, which we say creates more life, really helps them regenerate those cells and, in essence, build around damaged parts of the brain. I suffered a stroke at age 54, and then again just a couple of years ago now, and was fortunate enough to have an expert in neuroplasticity work with me in that recovery. Having a stroke was a very profound experience for me, both physically and emotionally. My passion has always been for seniors, and especially for those who have cognitive impairment, because I feel as though they don't always have a voice. But I recall driving down the freeway in Dallas and realizing that I was having a stroke. And so instead of pulling over and calling 911 like I perhaps should have, I drove myself to the hospital and told the personnel there that I was having a stroke. They were kind enough to get me in quickly and start some medication to help the stroke not damage the brain too significantly. But I did come away with an inability to speak correctly, and I lost my sense of direction, and I lost the ability to walk. I had very profound left side weakness. So I had, just before this occurred, met a gentleman and planned to do research with him. He was a specialist in neuroplasticity and brain science, which has always fascinated me. And so I never dreamed I would be calling him to help me with a personal issue in lieu of calling him to do research. But I did call him, and he offered to help me. And so he suggested, through this idea of using neuroplasticity to build new pathways around damaged parts of the brain, ways that I might get better. And so it gave me a true heart for those who experienced that. Fortunately, I was able to improve. Some of them cannot, but the sooner we can work with them and the sooner we can get them involved in this process, the better are their chances of slowing that decline and providing quality of life for a longer period of time. I think it's important for those of us who are leaders at Pegasus Senior Living to share a message with families and with the residents who are experiencing that journey of dementia. I think the most important message that we can give is that love your loved one, be social with your loved one, validate your loved one as a human being, laugh with them, have those moments of joy. Those are the things that are most important in giving them quality of life. The medical treatments can help some, but as we all know, there is no cure at present for dementia. So the best thing we can do through this process of connection is to connect with them in any way we can, through any of the senses that we can. If they enjoy chocolate ice cream, bring that. If they like to laugh at silly movies, sit with them and laugh. And above all, love them and help them be as social as they can with their friends and other family members. Because at the end, really, that's the most important thing we can do, is bring that joy and quality of life to them.